Hello, good morning. Today we will discuss about the Norma Occipitalis. You can see here I placed this skull in a Norma occipital surface. You can see directly the Norma occipital surface only. Hey, now first we will discuss about how the shape of the Norma verticalis. It is convex upwards and side and flattened below. The shape of the Norma occipitalis convex upwards and side and flattened below. And what are the bones present in the Norma occipitalis? We can see two posterior part of the parietal bones, and this is the squamous part of the occipital bone. These are the bones present, and also we can see the mastoid part of the temporal bones on each side. And what are the sutures present in the Norma occipitalis? We can see the posterior part of the sagittal suture, and this is the lambdoid suture, and also there are two more sutures present in the Norma occipitalis. We can see clearly, we can see this is the suture present between the occipital bone and mastoid part of the temporal bone. That is called as the occipitomastoid suture. And here you can see there is one more suture passes forwardly. That is present between the parietal bone and the mastoid part of the temporal bone. That is called as the parietomastoid suture. Now we will read other features of the Norma occipitalis. In the previous video we have read about the parietal foramina, ovalian and lambda. Now we will read some more features in the Norma occipitalis. What are the some more features? We can see there is a median prominence which is called as the external occipital protuberance. This is it marks the junction between the head and neck. You can see this is the median point, external occipital protuberance, and we can see superior lines and inferior nuchal lines, which are passes laterally from the occipital protuberance. This is the superior nuchal lines which is passing laterally, and you can see their inferior nuchal line also, and that part we will read in Norma basalis. The foramina present in the Norma occipitalis mastoid foramina, which is present near the occipitomastoid suture. We can see here is the mastoid foramina. The structures passing through the mastoid foramina are emissary vein and meningeal branch of the occipital artery. The emissary vein opens into the sigmoid sinus. Now coming to the muscle attachment of the Norma occipitalis. The medial 1/3 of the superior nuchal line gives origin to the trapezius muscle, and the lateral 1/3 part of the superior nuchal lines gives insertion to the sternocleidomastoid muscles above, and below that sternocleidomastoid muscle, the lateral part of the nuchal lines gives insertion to the splenius capitis muscle. Sometimes there is a presence of highest nuchal lines just above the superior nuchal lines. In case of its presence, the epicranial aponeurosis muscle attaches to its medial part of the highest nuchal lines, and for its lateral part, the occipital belly of the occipitofrontalis muscle will attach its lateral part. In case of its absence, these structures are attached to the superior nuchal lines.